which is based on creating the wax cones in the lower jaw, and then we are mounting this in the patient mouth, and then we are asking the patient to simply swallow the saliva, and the cones will get flattened, and the patient, during on this process, the patient will establish the new vertical dimension inside the oral mouth. About the linear occlusion. Linear occlusion was introduced by Frusch. He simply changed a little bit the nomenclature of the tooth contact, because he introduced one-dimension tooth contact, which is creating but by using the blade in the lower jaw and flat surfaces in the upper jaw. He claimed that when we are considering normal three-contact position cusps occlusion, we are referring to three-dimensional contact, because we are talking about the length, the width, and the depth of the contacts. In the case of the monoplane occlusion, we are referring to two-dimension occlusion, because we are talking about the width and the length of the contacts, and his linear occlusion is referring to one-dimension occlusion, because there is only contact on the blade. Main characteristic and advantages of this concept: the simplification of prosthodontic procedure, 0-degree overbite and vertical overlap, one-dimension blade contact, flat occlusion plane. First premolar is beveled at 45-degree angle. It's because to avoid the contact during movement into the front of the mandible, and with the use of the blade, there is a big increase in chewing efficiency. So from a lot of articles which we can find of PubMed, we know that the length of the occlusion surface doesn't matter. The teeth number doesn't matter. There's also it doesn't matter if the teeth are anatomic teeth or semi-anatomic teeth. The patients are always really satisfactory of the chewing process. So this is why there is no reason why we should restore the arches to with more teeth than the 6. This is why we can easily use the non-anatomic or semi-anatomic teeth, and also this is why we can use the reduction of the width of the teeth. I would also like to show you some new cases and some new surgical approaches. This is I know that the first combined with the socket shield technique and the bicortical implant was made here in India by Dr. Vivek and Dr. Femina. Exactly. So this is the second case. I think this solution is very nice and very good, especially in a case when we want to achieve high aesthetics. This is the outcome after 5 days.
Dr. Lukasz has praised your case.
Yes?
I saw on Facebook.
Oh, nice to hear you. Thank you very much. And this is also the case of the perfect aesthetics. Actually, I want to present those cases because during many discussions, one of the things which are against us, this is the other dentists, the two-stage implantologists, they claim that we are not able to get very nice aesthetics, and this is obviously rubbish, and this is some cases that we can show them to support our work. This is right after cementation. This is few days after cementation. This inflammation is because there was some cement inside the sockets. This is really important. I want to show this. This is really important because in a case of freshly extracted teeth, we should really use techniques which allows us to control the amount of cementum and to avoid a position like this. Of course, after removing and scaling, this healed after 1 week. Lately, we also are working with the screw-able prosthetics. Of course, it's up to you if you will use the normal heads or the upper heads. I think the aesthetics right now, especially when we are using the metal composite bridges, the aesthetic is perfect in both of the cases. This is the lower jaw, this is the upper jaw, so there's basically no difference. This is the case when we use the metal composite bridges. This is also metal composite bridges, and this is metal composite bridges in the lower jaw. So I think we can really have the great aesthetics, and there is no difference between our and two-stage implantologist outcome. Thank you for your attention.